Health Minister Dr. Ampreen Lyngdoh said that though Meghalaya had exempted its citizens from compulsory Aadhaar registrations, health benefits of certain central schemes cannot be availed without Aadhaar. Briefing media persons on Aadhaar being made necessary for availing MHIS benefits, Lyngdoh said certain schemes of the Government of India are linked to Aadhaar, such as the MHIS, as it is now tagged along with the Prime Minister's special scheme for provision of affordable health facilities. So that necessitates Aadhaar linking. Lyngdoh also stated that Aadhaar now is getting linked to everything, and the citizens have understood the importance of linking Aadhaar for availing any benefits of the government. Encouraging the people of the state to register for Aadhaar, the minister further said that the step will greatly benefit the family in making them avail many schemes.
Its citizens from compulsory Aadhaar registration. Certain schemes of the Government of India are linked to Aadhaar seeding. The food and civil supply, ration, facility for beneficiaries is again linked to Aadhaar. The MHIS of the state of Meghalaya, because it is now dovetailed along with the Prime Minister's special scheme for the provision of affordable health facilities for the citizens of India. So that also necessitates that Aadhaar linkage and seeding is compulsory.
Professor Indrajit Dubey,